So Grace Hospital's a private elective surgical hospital, and it's been here in Tauranga since 2007. So we're getting close to 20 years on this campus. Since 2020, we've expanded the theatres that are on our campus. We've added 3 new operating theatres over that time, since 2020. So we've currently got 9 operating theatres, 3 procedure rooms, and on average around 11,000 patients a year come through Grace Hospital for procedures. We're very lucky. Vital Healthcare, who are an investment company that specialises in hospital and healthcare facilities, they support us along with our shareholders, Southern Cross Healthcare and Evolution Healthcare. They've invested a lot of money over recent years to expand our facility here. We've responded to the demand in the community. A lot of the surgeries that we perform here are orthopaedic surgeries, and that reflects on that kind of population: joint replacements, knees and hips. Sadly, as you get older, the old knees take a bit of wear and tear. But we do perform a wide range of other surgeries as well: general surgery, urology, ear, nose and throat, gynecology. Some of the complex surgeries are spinal surgery, also some of the more complex general and urology surgery. We're currently constructing a very large multi-million-dollar extension to the hospital, so we'll be adding some more inpatient beds and also back-of-house facilities. It's really important for us that the staff have a good environment to work in, plus expanding our sterilising unit, the service areas like procurement, stores, etc., because all of this was designed for a 6-theatre hospital, and now we've got 9 plus the procedure rooms. So all of those areas are going to be expanded over the next year, 18 months. It will be completed. We are very interested in sustainability. So over the last few years, we've replaced all of our light fittings, LED, for example. We've currently got steam boilers, for example, and there's an opportunity to look at electrically powered boilers for sterilising and hot water, etc. Because we're a private hospital, patients have a choice whether or not they come and have their surgery here. They have an expectation that in private we'll provide a really high standard of care and the latest technology. So for example, we've got robotic assisted technology here at Grace. We have the Da Vinci robot that's mainly for urology, general surgery and gynecology. And more recently, we've obtained a Mako orthopaedic robot, which is used for joint replacements, knees and hip replacements. The important thing about the robotic technologies is they assist the surgeon to be more precise with their surgery. We're one of the larger employers in our community. We have between 300 and 400 staff. We have around 100 medical specialists, and we also contribute to training and development of registrars, and fellows come here to advance their training, surgical fellows. We support the local polytech with clinical placement for nurses in training and students, and we employ new graduate nurses. So around the country there's often talk of short staffing and shortage of health professionals. We're very lucky, and I think it's probably related to our reputation, that the quality care that we are able to offer. We are able to attract good staff to come and work for us. Part of that attraction is working in the Bay of Plenty. More recently, the developments in the Bay, I think the CBD precinct has really lifted our game, and I think for particularly professionals coming from overseas, they want to see that side of the community. And I think that's really important, that we're enhancing that with the developments that are happening downtown. We support the local public hospital. Most of the specialists that come from overseas usually start working in the public facilities initially, and then they branch out to work in private as well. And being able to have our private hospital here means that the public hospital can attract medical professionals from overseas who are looking to that kind of work environment. So our construction project will have a partial handover later this year. We'll get some of our facilities handed over. Really looking forward to that. And the project will be finished by middle of 2026. So we're really looking forward to welcoming more patients to Grace and potentially more staff to come and work here. And I think it's going to be a good outcome for the community as well.